Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before they blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Young to Learn. Host, Harry Precious. Executive Producer, James.
Hi, thank you for joining us here on the Discovery Show TDS TV. Here we say Yen to Learn. On TDS TV, what we do basically is to interview professionals who are in the diaspora making significant impact in their own area. Significant, of course, is relative. And we just want to explore their lives and just to learn from them so that we'll be able to climb greater height. My name is Precious Adadidiodu, ably produced by James Kwabena Opon. Today, we are speaking to one gentleman who is a nurse by profession. He has many other professional backgrounds. Perhaps you talk to us about that. But currently, he's a PhD nursing student at the College of Nursing and Health Sciences at the University of Massachusetts, Boston, United States of America. I'm privileged to be joined by Mr. Evans Frimpong Kyei. Yeah, welcome, Evans.
Thank you.
Thanks very much for joining us here on the Discovery Show. So thanks, viewers. Please feel free to send in your comments, your questions, and we will definitely ask Evans where necessary. So Evans, tell us a bit about yourself. Who is Evans Frimpong Kyei?
Thank you. So thank you to your cherished viewers. My name is Evans. I'm a registered nurse. I obtained my first nursing degree in Kyei University, bachelor's, and graduated in 2013. Then went back for my master's degree at the same department, graduated in 2019, and currently I'm a PhD student at the University of Massachusetts, Boston.
Thank you very much. So, that is a very interesting trajectory. Do you want to share a bit more about your professional trajectory as well in terms of work experience?
Okay, so with regards to work, I started my professional experience as a nurse tutor at Premier Nurses Training College in September 2014.
Then, you mean in Ghana, because we have people watching that beyond
so
Ghana.
In Ghana in September 2014. Then in April 2017, I joined the Ghana Health Service, where I was stationed at Asnomaso Government Hospital. So throughout from 2017 to 2021, yes, I was stationed at Asnomaso Government Hospital. So from 2017 to 2021, I was doing both. I was combining as a nurse tutor and at the same time a clinical nurse, both at the hospital and at the college level. Yeah.
Brilliant. Looking at the background you've given so far, currently as part of your PhD, you are also a teaching and research assistant. So, you are still in academia, so to speak, beyond your PhD, and you're also a nurse as well. How early did you identify your career path? For which reason you have pursued these, educational, trajectories?
Well, I think it will be right after our bachelor's degree. When I got a teaching opportunity, I felt that, well, this is where I want to be. academia. So I started preparing myself for that. Through that, I obtained a diploma in education to enhance my teaching skills from University of Winneba. And I had remained there as a nurse tutor. And through that trajectory, I felt like, yeah, this is where I belong. I want to improve nursing teaching. I want to improve how nursing is being taught in Ghana. So that's where I felt that, okay, I want to be in academia. So if you want to remain in academia, you need to upgrade yourself. So I had to pursue a master degree just to sharpen my skills and everything. Then through that, I realized that no, I can't remain there. I have to also move further if you really want to add to something better to the academia. Then I have to also pursue a PhD. Yeah.
Interesting. Interesting. I'm sure we will delve into this a bit more going forward. But I mean, just let me go back to your clinical practice in itself. You are fortunate to currently be living in the US. I mean, as far as I'm concerned, you are not practicing as a nurse, but of
Yeah.
course, you are studying as a PhD student. But what sort of key lessons or takeaways did you have from working with the Ghana Health Service? If you were put in the helm of affairs today and you asked to address specific issues in the Ghana Health Service, what are the key things you highlight?
Well, I think that the first thing that we need to consider is the condition of service for the service members. Honestly, comparing the conditions of service for Ghana and comparing for the US, there's a vast difference. Although Ghana is not that doing bad because I've worked in Sierra Leone. In Sierra Leone, when I compare the condition of service for nurses in Sierra Leone and Ghana, Ghana is way ahead. That doesn't mean that we can still improve upon what is happening. There's more room for improvement. My, let's say, 4 years experience with GHS, I realized that our conditions of service is very poor as a nurse. And if I'm placed at the helm of affairs as maybe a top position in Ghana Health Service, that is one key point that I have to work on, because it's really sad that nurses work beyond their scope of mandate, and they do all sort of things, especially those in the rural areas. They consult, they prescribe, they treat, they do everything, and yet they are not being considered when it comes to remuneration. And that has caused this brain drain that is currently happening, because we are losing our skill set, we are losing our skill members to overseas, because they feel that they are not worth it, because they sacrifice a lot, yet they are not being appreciated. Sometimes it's not always about money, it's about how you let the person feel that yes, what you are doing too is being recognized. And I think that currently, I think that GRNA is doing much better than the previous administration. They are trying to acknowledge some of the selflessnesses in the system. So that's okay.
Thank you very much, Evans. I mean, you did mention earlier that you realized that you go into academia, so you did a diploma in education.
Yeah.
I mean, back in Ghana, I think we were very clear about the main things you could do as a nurse, or to a larger extent, a healthcare professional. Either you are into clinical practice strictly as a bedside nurse, or you are teaching.
Mm-hmm.
In Ghana, do you know of any other opportunities beyond just these two traditional, opportunities I've spoken about? And then even beyond Ghana, I mean, since you've traveled or with your own experiences, what sort of career opportunities exist for nurses for which, they can pursue, especially if they want to live bedside or they don't want to go into academia strictly?
Yes, one thing I noticed was that we can enter into research. Sometimes you see, once we graduate, it's either bedside or academia. Probably we are teaching in a nursing college or we are in the hospital. But one other key area that we can work on, it's also being in a research center. For instance, we have Noguchi, we have CSR, we have these KCCR centers, research centers that's being located in Ghana and overseas. And I think that we will be able to work and fit very well if we apply there, because we are being taught research methods, we are being taught how to apply research, and these places, that is what they do. So sometimes we should also widen our scope, trying to look beyond the classroom and the bedside and look at these research centers. Also, when we talk about these pharmaceutical companies, they will usually pick people who represent them in the medical affairs, and they do go and market their product. Of course, you know something about drugs, you know something about these pharmacology things that work. So if they pick you, you should be able to present their product at top centers where you can market them because you have learned it. And sometimes it's not about what you have learned, it's the opportunity that presents itself. You should be willing to fit in. I remember I did apply a job in Nestle and I was like, can I work there? Is it worth it? Later on, I realized that no, this is a good opportunity because they deal with nutrition, and nurses, we also tackle nutrition in some part of our work. But sometimes we don't even think along that line. We are just focusing on the bedside and the academia, the teaching. But there are several companies, multinational companies that we can work around, including these, nutrition companies and these research centers. Yeah.
I mean, it's very interesting, Evans, the sort of alternatives you are given. But I think the conversation really will be that, do you think our educational system perhaps equips us, maybe with a bachelor's in nursing, to be able to go into a role that involves or that requires you to carry out research? And with no particular emphasis on this, but I have colleagues who are pharmacists by profession, and after school, whilst perhaps they were studying for postgraduate, they were doing their own jobs with pharmacy companies, and they were employed to market their product to hospitals. Yeah. You will say that perhaps their program equips them to go about doing that, but do you think that just a bachelor's degree in nursing will give you that sort of, footing to be able to go out to negotiate with these companies to be employed?
Yeah, I think it's about how you brand yourself and how you package yourself. It's all about branding. Some of us, we didn't have that experience. We didn't know that opportunity even exists right after school. We didn't know. We just zoomed into searching for jobs. We're looking at two ends, either in the classroom or either in the bedside. But growing up, trying to be in the profession, I noticed that no, there are several opportunities that lies outside our bedside. And I would say that fortunately, I think right after 2015, the NMC reviewed our curriculum for the training of nurses in Ghana. And now they've added some entrepreneurial skills and supply chain management and other courses, which I think that though is not enough, but we can improve upon it. And this is a challenge to our universities. We see we have been using a curriculum that has been in existence for over 15 years. And when I compare the curriculum in Ghana and the curriculum here for bachelor's degree, you do something about healthcare finance, you do something about healthcare policy. And it will interest you that some of these students, once they graduate, they decide, okay, I'll not work in the hospital, I'll work in a pharma company, I'll work in a health commission, because that student has learned something about policy. That student has learned something about health and not necessarily about nursing. So once our universities decide to maybe restructure our curriculum, I think we will best match this market. But once that's not done, I think that is about how you package yourself and how you brand yourself. Yeah.
Very interesting. I mean, I remember during my master's, I contacted one of the lecturers, top lecturers back in Ghana, mentioning that I thought health economics was something that was very critical to our job, because at the end of the day, if you are being trained, even if you're on the ward and you're going to be a ward in charge or whatever, you need that sort of idea to be able to manage the ward, the consumables you are buying. And generally, we need those basic financing skills. So I think that is good. To stretch that a little bit, you've mentioned a few things that could be included in the curriculum. Are there any other things off the top of your head you think could be beneficial if policymakers are listening to us?
Well, I think that right after school, I think for our graduate programs, let's say undergraduate, there should be a form of a career seminar that should be instituted at the final year level. You see, when you look at other courses, for instance, let's say business school, when we were in Kenya University, right in the final year, they do invite these bank operations, bank association, they come have seminars for them. They try to, you have to quote your CV in this way, you have to do this in this way so that you can be ready for the market. But nursing, there's nothing like that. Once you are done, sometimes it will interest you that a graduate nurse is finding it difficult to even pen down his or her own CV. And because our minds are, oh, our job is already there. I cannot do anything else apart from the bedside. So what am I going to use CV for? So I think that our policymakers should also look at the other areas that nurses could work, and that they should maybe restructure our curriculum, then also probably organize these career seminars frequently for them, so that at least they will know that these are the options that are presented to me, so that right after school I know where to go.
Brilliant. Viewers, thanks very much for joining us here on the Discovery Show TDS TV. We say yen to learn. We are speaking to Mr. Evans Frimpong Kyei, who is a PhD student at the University of Massachusetts in Boston, USA. So please drop in your comments, your questions, and we will definitely ask Evans. We did speak about healthcare, finance, and all that. I mean, I think traditionally where we are coming from, our society has trained us such that a lot of people, not everybody anyway, we depend on only one source of income. So you work strictly from, let's say, 95, you've closed. So if you're a nurse, maybe you're having a shift, you close and that's all. I mean, back in Ghana, I've known you for some years. You were working clinically, and also, I mean, that's full time, and you were teaching at the same time, full time. So, right from the onset, you thought about multiple streams of income. What was the motivation, and what sort of tips will you share with other people if they are in Ghana, Nigeria, wherever, or even in the UK, for them to position themselves to also, I mean, derive some sort of multiple streams of income? Yeah.
Yeah, I think that one thing that drove me into that was, just as I said, the conditions of service for nurses. You realize that you are making a lot, you are making several inputs, but your remuneration is very few. You are not able to afford a whole lot of things. We can only imagine a normal nurse, let's say a bachelor's degree holder nurse working in Ghana. You ask, can the person even afford a vehicle for his or himself to even drive to work? It's difficult. So sometimes these situations will push you to the extra mile that, Neil, you are wasting so much time. There's more that you can do. And sometimes you have these, let's say, space to work, especially when there's no family. And so you are all by yourself. You can get out from work like 6 from home, come back at 6. But when there's family, you can't do that. But I think that we should ensure that we are not wasting so much time. You have a job at the hospital, that's fine. You work 5 times in a week, but you work within certain hours. So after those hours, what happens next? You can find yourself in a different office where you can work for even sometimes just 2 hours. That can earn you something. And recently I was like, sometimes, okay, someone will say that I'm not finding the job. You can also learn something new. There are several programs on Google, several courses that you can learn, informatics stuff, and add it to what you know already, so that probably within a year you'll be ready for other positions. So no matter where you find yourself, don't just go to work 8 a.m., close at 2 p.m., go back, I'm tired, just jump onto your bed. Once that you don't have family, then you know that you have time, you have space, and you need to build yourself now for the future. So I think that it's all about what you want to do, what you think you need, because you can't decide to rely on that single salary. No, it's not going to help you. Fine, some people will feel comfortable, but some of us it wasn't. So we had to go the extra mile to sacrifice, and probably that pushed us a lot, and that made us, like, brought us this far.
Interesting. Interesting. I think that is a bit thought provoking for our viewers, especially if you are built in a society where, I mean, we are mostly unilateral in terms of our source of income. So thanks for sharing that. But of course, that comes without challenges. Like you rightly said, if you have family and all that, would you want to share some of the challenges involved in, I mean, pursuing 2 different full-time jobs? Even if, I mean, for those watching, if they are not going to do full-time jobs, 2 of them, but even one full and then the other part-time, what are the challenges involved? I'm asking this because I know where we are coming from. People can readily be victimized. If your boss realizes that you are also teaching here or working here full-time, they find a way to mafia you, as we say. So what are the challenges involved, and how can people navigate these processes?
Yeah, I think that the main challenge sometimes in regards to the hospital, you see, with a hospital, you have a fixed time that you need to run. And me, for instance, I got opportunity to maybe make my own time at the hospital. So I was able to chip in my college also time. So it was working both for me. But sometimes you have to sacrifice your rest because you cannot rest. There's no resting period. I remember in 2017, I was doing my master's. I was working in a hospital and I was also teaching at a college level. 24 hours, my life was just packed. I was running night shift, going to the classroom to teach during the daytime, and also going for lectures. So sometimes you have to sacrifice your rest. Someone will say, okay, then I can run night shift or run weekend shift. Sometimes we are so much enthused about the weekends off. Someone like, okay, I want the weekends off. But me personally, I enjoyed working weekends because once I work during the weekends, I have weekdays off to do other stuff. So it's a bit challenging, but all in all, you need to sit down with your nurse manager or your ward in charge that this is what you want to do, and that you are not for the 36 hours you're going to work, but you want it at these times, weekends, nights, so that you can have the full day to yourself. Sometimes too, if those things are not happening, you can take up your own self-paced courses, and that one is at your own self-paid. So you close from work, you take some rest, then you log on onto your laptop, then you start your courses. These courses might not generate income for you at that moment, but in the near future, it's going to place you at a good position.
Interesting. Interesting. That is very good to know. Thank you very much, Evans Frimpong Kyei, for sharing this with us. Viewers, as said, please send in your comments, your questions, and we'll definitely ask Evans for you.
Meet Mr. X, an unhappy businessman who has been waiting for days for his goods to be delivered. Unlike Mr. X, business is booming for Mr. K because of his efficient partnership with Hembeck 60 Hub, also known as HP 60 Hub. We are an online platform that sources for goods from across the globe. We only pull high quality standard products from anywhere in the world and ship them right to your doorstep. Be it watches, clothes, bags, and many others. Do get in touch by contacting us on www.henbeckagency.myshopify.com, or you can call us on +233 546 022 952 or hembeck@gmail.com. Hembeck 60, truly a world of endless possibilities.
Thank you for sticking and staying with us. So wherever you are across the world, if you want to buy books, bags, any of these artifacts that are scrolling on your screen, if you want them to be shipped to you, you want, someone to buy them or a company to buy them, source them from the best of retailers or wholesalers, and then ship them to you. Footwears, clothes, watches, bags, and books. Please contact Hembeck 60 Hub, and they will do the best of jobs for you. You can send them an email at henbecktravels@gmail.com, henbecktravels@gmail.com, or you can just send them a Facebook message at their Facebook name is Hembeck 60 Hub, Hembeck 60 Hub, or you can send them a WhatsApp on +233 546 022 952, +233 546 022 952. They are the proud sponsors of this program. So Evans, a lot of people know you too. Of course, there are some names they call you. I won't mention that. But you seem to be very well informed about a lot of things. We just want to know, I personally have benefited from your wealth of experience, especially after school and all that. Where do you get that motivation from? How do you go about that so that you are very well guided? If you're speaking to somebody about anything, you are very well informed about that. What gets you going, and how can people also, what will you tell people to do to ensure that they are well informed about what they do, especially in terms of their choices, career-wise, whatsoever you can think about?
Yeah, I think that it's, let's say, in this world, in our part of world, it's all about information. You get it? It's all about information. For us, some of us, we didn't know. We didn't have those information. We had to go through that experience, pay for that price. You get it? When we were graduating, we didn't know anything about graduate school. We were just trying to just apply to UK schools without scholarship. Then you just back it or find something to do. We didn't know about going to work in the UK, going to work in the US. We didn't have this information. So we had to go through and pay it ourselves. So sometimes when we share experience, is our hard-earned experience. At least we've passed through and we know that this is going to work for you. Just hit it right. It's going to work for you. Some of us, we wanted to improve, but you see, there was no one to talk to. Sometimes you talk to some of your previous maybe bosses and they'll be like, hey, you need to work for a while, you need to get the experience. And these thoughts and these advices made us stay back. It made us sit back. Okay, then definitely we can do something. But later on we realized that no, all is not well. We need to take that step. We need to move. So it's about a yearn to improving yourself. You need to improve, especially when you know where you are coming from. You need to make an impact, both professionally, academically. You need to. So sometimes it's our hand-earned experience that we share. We have faced it. We didn't know any guidance. We didn't have any guidance. We didn't know who to talk to. We had to just maneuver our way, and we have the good and the bad. So sometimes when we talk to someone, we share the good ones with you, because I will not tell you to do it because I did it, it didn't help. So once you do this, it's going to help you. So probably it's our hard and experience that we sometimes share. And as I said earlier, it's all about information. You need to ask.
Okay.
You really need to ask. That's one thing that I don't hesitate doing. It doesn't matter whether the person is your senior colleague or junior colleague, it doesn't move that way. You see, sometimes we think, okay, I graduated earlier than you and I'm your senior. It doesn't work that way. Sometimes you need to take these things from your junior colleagues, and it doesn't matter. So once you know that it's all about information and you ask the right people, you get the information that you need, and that will make you progress. That will change your thought totally. Because me, I have people that I talk to, I call and say, hey, you are wasting so much time. This is what you are worth. Don't waste too much time there. Do this, do that, do that. And it works for them. So sometimes it's about information and who to ask. Sometimes you need to also go online yourself. Google things. Everything is just in your palm.
Yeah.
Just Google and make that effort. It's a bit difficult, but I feel that you need to sacrifice. You need to make that effort in trying to achieve whatever you want to achieve. It can be like monetary aspect, everything. I have one colleague who will be joining us in UMass, and he was like, I had to use all my service money to do applications. And I said, like, yeah, it's worth it. Now you have everything that you got to. You'll be coming to the stage, you'll be starting your PhD program. It has changed everything for you.
Yeah.
So sometimes it's all about information. So that's what I would say.
Thank you very much, Evans. I have personally advocated on this platform that, I mean, to a larger extent, where we are coming from, I mean, the society in itself makes us feel as though if you reach out to ask people about something, it's a sign of weakness. But for me, it's rather a sign of strength.
Yeah.
You admit to your limitation. So if you are pursuing a particular path, and as Evans said, you think he is the right person to ask, or any other person is the right person to, don't hesitate to ask, or if you can check it yourself, please go for it. So thank you very much, Evans. You did talk about postgraduate study and all that. You did your master's in Ghana. I want to believe perhaps you also tried externally and all that. But tell us, if there's someone watching us who perhaps would want to pursue masters but do not have what it takes. I mean, if I talk about what it takes, both financially and I mean, family-wise, a lot of circumstances. So they would like to do that in Ghana. How difficult was the process? Can you tell us briefly something about that?
Applying in Ghana?
Yeah, for a master's.
Postgraduate studies in Ghana.
That's right.
I would say that for Ghana, the application process is not that difficult because there's nothing like a scholarship for you. You have to pay fees. And we are talking about thousands of cedis. And I think now averagely you're going to spend like 15,000 a year for a postgraduate degree, preferably in nursing. For a PhD, you're going to spend like over 30,000 a year in nursing if you want to go to University of Ghana for a PhD. So it was a bit challenging because as a young graduate, how do you cough out almost 20,000 cedis to just get a master degree? And nothing will push you to do it. But sometimes, if you are lucky, as I said, you have multiple sources of income and you can raise that money. Of course, it's good. You can just try it, but it's a bit difficult, especially in terms of finance, trying to finance your whole master's project, especially when it comes to your research and everything. You have to go through that all by yourself because there's few or let's say non-scholarship available at those departments running the programs.
Okay, brilliant. So, I mean, for people who would like to apply, is there any cutoff for what sort of, I mean, class they graduated with and all that when it comes to masters in Ghana, especially?
No, for masters, I think that once you have second class upper with few working experience, you can just apply. And sometimes if you have just 1 year working experience, it's all about how you tease out your statement of purpose and your research interest, that and how you perform during the interview. So that's it. And now we have a lot of master program for nurses in Ghana, from Legon to UCC to KNUST, a lot of programs, both in financing, public health, MPhil nursing, clinical nursing, nurse practitioner. There's a lot of programs. And of course, some would also choose the professional way and go to Ghana College of Nurses and Midwives, of which that one too, they want to maybe pursue their professional thing. So it's for now, there are a lot of programs, and all you need is just a bachelor's degree and maybe a second class, either upper or lower, you qualify.
Okay. Oh, that's brilliant. Thank you for letting us know. So let's zoom straight into the PhD application for you, for US. What was the process like? Can you take about 10 minutes to take us through the application process? What sort of documents are involved? If there's somebody who wants to apply for a PhD in the US, what are the things, the tips, the tricks, and the trips that you want to tell us here? About 10 minutes.
Okay, so with the US application, it's quite different from, let's say, the UK or Australia, because I have tried Canada, Australia, and UK. With those ones,
You
yeah,
have experience.
you need to identify, let's say, write to your professor that you really want to work with. And once the professor approves you, then he can give you the go ahead to tender in your application. And sometimes you need to add a research proposal to it, how you want to carry about your whole research. But let me say the US is quite different. With the US, you see, we take courses. With the first 2 years, you're going to take courses. So they are not so much interested in your research. So you don't submit any proposal, but you need to submit a statement of purpose, a strong one as such, because that is the only thing they're going to base on to admission or not. And you just have to pick a research interest that aligns with a specific faculty. And that is where the difficult thing comes in. Because, for instance, for me, I had to search a lot of schools. Let's say you pick UMass Boston, UMass Amherst, University of Connecticut, Yale University, UPenn. Then you go through their faculty profile. That is the first thing you need to do. Your faculty profile. Identify that specific faculty who shares your research interest. Once you are okay with that,
if you can use those lay terms, what you mean is that the lecturers, the doctors, and the professors.
yes,
That's what
the
you
professors,
mean.
yes,
Fantastic.
yes, the faculty, yes. So the professors or the lecturers, you have them listed on their website, the specific university website. They have all their published papers. They have their research interests there. So once it aligns with your research interests, sometimes you can go extra mile to just pick one of their papers and read how they went about the whole paper. Then you know that now you have one. At least you should pick a minimum of two, because if this one does not accept you, the other one can accept you. So you have two. Then you go to the application materials, the requirements. It differs. In the US, it differs. Some do require GRE. Others have waived their GRE. Others will tell you that once you have a master degree, you don't need GRE. So once you go through the application requirements, others also need WES evaluation, which sometimes become a stumbling block for people because they feel like, oh no, I can't commit $250 for just evaluation. What if I don't get the school? So it puts them off. So once you get to know the school requirement, sometimes you just have to get a jotter. For me, I had a smaller book that I did myself, like every day I'll search about 5 schools. So I have all these schools written down, their application start date, their end date, the professor I have identified, the application requirements. Sometimes doing this for about a month, you get about, let's say, 35 schools that you really, that this is the schools that I want to apply. Then the next one is go about their funding status. Of course, if you have money to finance yourself, that's fine. But some of us, you have to depend on the school, like let's say for full funding. So you check some of the schools is a guaranteed funding. When I say guaranteed funding, once you get the admission, they're going to fund you. And some come in two ways. Some are on scholarship, some are on just graduate assistance. Either of them is okay. You'll be able to survive. So once you get to know that these things, these schools are the schools that's going to provide me funding, then you tease those schools out of, let's say, the 30 or 35 that you've penned down. You come to about 5 or 7. And sometimes you have to just do that 5 or 7 applications at a go, because you really want to get options. And as my friend would say, you always have to get options. Options are a good thing. So once you do that, get about these 5 schools, then you do apply, then wait for the outcome. Sometimes the WS evaluation, you do one, you can just apply it to all the other schools. Some do require GRE. If that is a school you really want to, then it means you have to write a GRE, because it's a requirement. And one thing I also notice is that the GRE is sometimes it kind of segregates you from the others. Once you're able to write your GRE, it's like a lot of people wouldn't like to write it. So once you write a GRE, it sets you apart. It makes you far from all those others who wants to apply. So you realize that your application becomes stronger and you are likely to get the admission. Thank you.
Many thanks, Evans. So you did talk about evaluation. I mean, if someone is watching us and not clear, what do you mean by evaluation?
Yeah, so we schooled in Ghana, and most US schools and Canada, they feel that they need to evaluate the school that you went in Ghana, the courses that you did, the courses that you took, and try to equate it into the US system. So that is what we call the term as evaluation. So we have a renowned one, the World Evaluation Service. You have to apply with your transcript and everything, and they can evaluate up to even nurse assistant. Sometimes, yes, they do nurse assistant, diploma, bachelor's, master's, they can evaluate it and just transfer it into the US system. Sometimes the university wants to be assured that, yes, this person is the right candidate. So they just want to evaluate your transcript and see that, yes, that's good. And I feel that is a good thing for us, because once they evaluate it for you, it's yours forever. I did my evaluation, I think, in 2018 or so, and I used it in 2021. So it's a good thing. And now most US schools require evaluation. So that is one thing that you need to work on.
How expensive is that?
I think it costs around $200 or something. Yeah. And there are other associated costs, which, let's say, I will say that it will not go beyond $300, because you need to send your transcript, you need to go to your university to request for the transcript and send it by DHL. And now I think they are doing more of electronics, so it's cut down a lot of cost. So around $220, you are good to go.
Okay. I know the US have a slightly different system with respect to funding when it comes to the UK. Of course, you can have a mix of that. But one thing you did mention, and you are a graduate teaching and research assistant, is that an alternative source of funding? So what I mean is that you can be given the funding, but the job you have to do for you to get your stipend or to get the sponsorship for the program is to be a graduate teaching and research assistant. Is that the case? Is that your situation?
Yes. So with we call it graduate assistantship.
Okay.
It means you are working 20 hours a week. And these 20 hours a week that you are working for the professor or the department or whoever you are your supervisor or whoever, they are providing you a tuition remission for that work that you are doing. So it means that they're going to waive your tuition fees, then going to pay you for the 20-hour a week that you are doing. So that stipend is what you're going to use for your upkeep and other expenses that you may incur during your postgraduate studies. Sometimes too, the universities have scholarships.
Okay.
That you can apply differently from these assistantships. It might not be much. Sometimes a few as like $1,000, $3,000. That one will come aside your assistantship. And there are schools that will offer you guaranteed scholarship. That one, you don't work for it. you are just focusing on your study. The top schools, the Ivy League schools, they're going to provide you scholarship, and let's say we are going to grant you with maybe $36,000 a year. That one you're just going to study, and they'll just pay you. So that one is you are not working for. If you are fortunate, you can get
like Samuel Trim. He doesn't work
yeah,
for it. He
yeah,
gets free money, isn't it?
yeah,
Okay, all right.
yeah. Not free because at least he's studying. That's what he's doing. Yeah.
Okay, brilliant. So, I mean, just let me ask, in your situation, just as you rightly explained, here in the UK, if you have a scholarship for either a master's or a PhD, you don't have to work for it, just like you have to do for a graduate assistant. And so beyond that, your visa permits you to have maximum of 20 hours per week work. You can work extra 20 hours. If you're a graduate assistant, in which case you are supposed to be working 20 hours, are you also allowed to work externally to get some extra income?
No. Your 20 hours a week is what you are doing with the university. And in the US, you cannot work outside your campus. You cannot work outside the university campus. If you want to work, you need a permission. That's the OTP, where that's OPT. Yeah, sorry. You need to request for it, and it has to be tied to a course that you are taking. For instance, you are taking, let's say, a health policy course, and you want to do an internship at the Public Health Commission. So that internship can come out being paid or not being paid. And that one you need permission because it's outside the university.
Okay.
So you need for the ISS department to issue you with the OPT where you can go and work. So, and that one, it shouldn't go beyond 20 hours.
Okay.
During school hours. But during the summer, you can work 40 hours. But even with that, you still need the OPT from your university before you can go do work. But once you are on assistantship, you can't do any extra work again. It's just the 20 hours that you are doing.
So can I safely assume that if you are on the graduate assistantship, the money is quite good to sustain you within a month? Let's say you don't have a family. Is that good enough?
Oh yes, it's gonna. You see, the stipend is designed to sustain you alone. Yeah, but you know where we come from. You want to save, you want to do this. So sometimes you feel like the money is not enough. But what they are going to give you is what can sustain you within the month. And with the US system, it depends on the particular state that you are in.
Okay.
I'm in Boston. Boston is expensive. Someone is in New Jersey. New Jersey is expensive. Let's say the East Coast is very expensive. Someone in the Midwest or the other places, that little money comes, the person can afford a rent of like $300 a month, but you can't afford a rent of $300 a month in around the East Coast. Sometimes you're going to pay as high as $800,000. So it depends on where you want to apply the school. So all these things, you need to do all these background checks. You all need to do this background check. You can't, let's say you are earning like $2,000 from your stipend in Boston. Someone is earning $2,000 in Michigan. The one in Michigan is more richer than you because cost of living in Michigan is far less than in Boston. So sometimes you have to do this economics and stuff to get to know that, okay, this is where I'm going, this is how much I'm getting, and this is how much worth I'll be. So you have to also do all these checks. You can't just get up and say, okay, I'm going to University of Maryland, I'm going to University of Boston, and no, it doesn't work that way.
Brilliant. Thank you very much, Evans Frimpong Kyei. He's a PhD nursing student at the University of Massachusetts in Boston, and he's been speaking to us about a lot of things. Thank you very much, Evans. I know time is really not on our side. So let's move straight a bit into your PhD. What is it about? What is your PhD topic and what is it about?
Okay, so I'm working on, our program is focused on health policy and population health. We are looking at specific health policies which affect specific populations. So you need to look at policy. You need to pick a policy and you need to pick your population of interest. You know, in the US, we have several populations. It's the only country that when you are filling your form, you have Asian American, you have Black American, we have Haitian American, Latin American. So we have these specific populations. And here, they do interventions based on the population.
Okay.
Because we have several disparities that occurs here. If you're outside, you might think something different, but there are several disparities that occurs here in terms of healthcare accessibility. So our program is basically about health policy and population health. And my research area, I'm looking into opioid abuse. I know opioid abuse is a major problem in Ghana, but I think we have more serious issues in Ghana, of which bosses are focusing on. But here is a major issue.
Yeah.
Yes, opioid is a big issue here in the US. So that's what I'm looking at. And I'm looking at the prescription practices because they have policies regarding the prescription of opioids. And these policies seem not to be favorable for the blacks here because their pains are not sometimes believed. You go to the hospital, you complain about your pain, they feel that you need an opioid just for your sedative activities.
You know what? Let's safely assume that a number of our viewers are not medically inclined. What do you mean by opioids? Break it down for us.
Opioid is just an analgesic that we use to manage pain.
Even the analgesic, we don't know what it is.
So let's say someone has pain. You got a fracture, you have pain. You cannot go and take paracetamol. You need a drug, a stronger version of analgesic that can manage your pain. So here we have these, they are everywhere, like tramadol, for instance. Ghana, you say tramadol. So people take it for just they want to feel high or something. Here is a big problem that people just smuggle their way, get the opioids and take, and they sometimes end up in overdose deaths. And these are major issues that is affecting their healthcare system. They are trying to deal with it. Yeah, so that is what I'm looking at. I'm looking at the prescription, the laws regarding opioid prescription in the US and how it's affecting the Black Americans here. That is what I'm working on.
I think your project is very time sensitive because I think in the past year or two, that has been a very great growing concern in Ghana. A lot of people, youth, as we call travel, taking travel. And I mean, I have spoken to pharmacists on this platform who have raised very genuine concerns. I mean, it comes back to what you're saying, the laws regarding prescription and all that. So I think for me, maybe after PhD, maybe you could consider doing a postdoc and maybe consider Ghana and all that. It's something that we also need. So that is a humble plea from this platform to you that perhaps you can look into that from the Ghanaian perspective as well. So I just will come back to, if you want to take an opportunity to talk to us broadly, one or two things about opioid misuse and even drug addiction in general, because I think where we are coming from, even paracetamol, you and I know that it can be dangerous to our health. So do you want to broadly, not into detail, about 2-3 minutes, talk about drug addiction in general? Is there anything you want to tell our viewers?
Yeah, so there's something special with regards to opioids because let's say I had a dental surgery, I went for tooth extraction, then I was given hydrocodone, like an opioid to take to manage my pain. It's like you take this drug, then within some few seconds, your pain is off. You don't feel anything again. And I've been taking this opioid, and these opioids are addictive in nature. They are very addictive. So immediately you feel the pain, you go take one tablet. Then you realize that even your pain is off, but you can't stop taking this opioid. Others too take it because they want to get more energy to even work. When you go to our casual workers in Ghana, sometimes they take the tramadol because they feel they want to get more energy to do this manual labor. So this addictive nature of these drugs, you end up becoming addicted. Then they keep on taking it, and sometimes they get to the intoxication level, which sometimes results in overdose death. That is one aspect. The other aspect is there are people who are in chronic pain, that their pain needs to be managed. Their pain is not as a result of, they are in pain and they need to be managed. They get the opioid prescription right, but they end up becoming more addictive to the drug. And it's no fault of theirs. It's because they have the pain and they are being placed on the prescription. So they take it for a longer time and now they become addicted. So you see, at that point, you don't know whether to call them opioid abusers or it's as a result of their condition that have made them abuse. So that is the dicey aspect about the topic that I'm doing here, because some of them is as a result of their predicament. That is why they are taking opioids. For others, they feel like, hey, I want to get off the pain. I want to get off more energy to work. That's why they take it. So it makes the prescription laws a bit dicey. So when you get to the hospital, or your pain is not believed, because they feel you want to get a drug to just for your selfish purpose. Meanwhile, you might be in pain. And when it comes to marginalization in the US, it's evident. So when you are black, you feel like no, because when the crack cocaine era happened, blacks were more involved. They feel that we abuse this opioid, so their pain is not believed. They complain about pain. Sometimes they are not believed, and they end up getting this fentanyl, the common opioid in the US, getting this fentanyl on the street.
Okay.
And this is a big business for people. They smuggle this fentanyl from neighboring countries, and they don't sell this fentanyl in the pharmacies because you need prescription to buy it.
That's right.
They can hit the street and get it. So they get it at a cheaper rate, and it's very potent as well. And they end up in overdose death. So that is the main problem, because it's not about what is being prescribed in the hospital. It's about what is being shared on the street.
On the street.
And how do you control this? Just like the situation in Ghana.
Yeah.
You can't just walk to a pharmacy shop to say you are buying 100 cedis worth of tramadol. No, they can't sell it to you. But these youths have a way of what? Getting these drugs. Some people smuggle it from neighboring countries. They put them in their backpacks and they will selling without any authorization. Yeah.
Interesting. I mean, there's a lot to talk about, but of course, we will end that here. I think you're talking about pain. So for those who are watching us, and of course, we've spoken about research and all that. You did a few. I mean, you have a few publications, but I want to really focus on two of them because we are talking about pain. One of them is nursing-related barriers to children's pain management at selected hospitals in Ghana, a descriptive qualitative study. And the other one is exploring the educational needs of nurses on children's pain management, a descriptive qualitative study. Do you want to take about 3-4 minutes to, in layman's term, what were these studies about, and what can we take away in a layman's term? Yeah.
Okay, so it was a big project for one of our senior officers, and we were working as a team, and the project was about pediatric pain management. So we identified that pain management among PDs was a big problem, and we wanted to identify the root cause of this problem and try to suggest measures that could help curb it. So we started trying to exploring the whole problem, and we realized that our curriculum is not designed in such a way that nurses who are being trained at the degree and college level will be able to manage pain effectively. Okay. And unfortunately, we have few pediatric nurses in Ghana. Sometimes a whole hospital, we don't have even one pediatric nurse. It's just the general nurses who are managing this pediatric. And we noticed that their pain management was a problem. So we're trying to look at the barriers that was preventing them from managing the pain effectively. So we noticed that one, it was because of their curriculum structuring. Okay. Two, because we had few pediatric pain specialists, and also we had others who lacked the knowledge. They didn't even know that when a child cries, it's in pain. No, mame, obano, uniya, like those kind of words were the ones we were getting. So that was the whole project about. We tried to look at the barriers that prevent nurses from managing pediatric pain effectively.
Interesting. So, I mean, I think this is very critical for our nurses. Pain is, as we say, subjective. It is what the patient tells you it is. So if you don't have the requisite training, it means that we will not be doing our patients the best of services. So I think, like you said, I'm glad that it approaches the whole thing from a broader perspective, right from curriculum development to our individual skills. So thank you very much for sharing that with us. Because of time, we have about 6 minutes, and I want us to straightly talk about, moving your family. If you're a postgraduate student, maybe a master's student or a PhD student, wherever you are, from Ghana, Nigeria, wherever, you want a scholarship, you are moving to the US, and you want to move your family with you, what are the processes involved?
Well, I think that with the US, once you're a student, you either be on the F1 or J1 visa, and once you are legally married, your wife and your spouse, let's say your spouse, to just be on the safer side, your spouse and your children will be on a J2 or F2, and You just have to show the document from your international scholar service at your university, and they'll issue you with the I-20 document for your family, and they go there and process it at the embassy in your home country. But of course, you need to provide some finances to show that you are capable of taking care of them when they join you. Yeah.
You've said the thing as so quick and very simple, but of course it's a complex process.
Yeah,
So
it's a bit complex.
Yes,
it's a bit complex because currently most of the embassies are working in a limited capacity. There are no appointment dates, and sometimes you need to prove beyond doubt that indeed you are legally married. So there are documents that you need to add to it. Yes. And
can you tell us about those documents specifically?
So you need the marriage certificate, of course. Sometimes you need your wedding pictures, your brochure, like things that shows that you are legally married. That's it.
Okay.
Yeah. And
so if someone is married traditionally but not a white wedding, would that be accepted as well?
Unless they have a marriage certificate. Without a marriage certificate, there's nothing that proves that you are married.
Okay.
Yeah.
All right. So it's not about wedding. They can be traditionally married and still
of course.
signed at the whatever. Yeah. Okay.
Yes.
Great. Now you did talk about you need a proof. So in your situation, you had a graduate assistantship program. So was that funding enough for you to move your family, or you needed to provide some sort of extra bank statement? And roughly how much are they expecting you to have in your bank before your account before they could offer you that?
So as I said earlier, the funding that they provide for you is for you alone. So if you want to bring a dependent, it depends on the state that you are in, because the cost of living differs. For instance, and sometimes the university itself, they have their own provisions for F2 spouse and F2 child, how much you need to prove. It ranges from 6,000 to I think 12,000, depending on the university. Dollars. Yes, depending on the university. Because sometimes, let's say someone in Michigan or Ohio, the cost of living is very low compared to those in the East Coast. So it depends on the university and where the university is located and what they are quoting on the I-20.
Okay. So can we safely assume that if your spouse is moving in with you, it's not just a 6-month visit, but the person can stay with you throughout your entire duration of postgraduate studies? Is that right? So PhD, 3-4 years, spouse can stay with you. Is that right?
Yes. So it's F2. Once you are active,
we are confused because we are not familiar with the F2. It's F2 dependent visa. What sort of visa?
It's like the F visa. It's all about visa. Once you, the student, the principal applicant, you, the student, you are active here in the US, it means they are also active. Once let's say you drop out of school, they also drop out because they have no status again. That is how it works. So once you get work, then everything, once it affects you, it affects your family. Once they are with you, that's how it works. Yes.
Okay. So, I mean, do you need any document from your school to support the application? And okay, answer that, and then I can move to it.
Yes, you need it. That is the I-20. The I-20 is issued by the university. So once you are here, you have an I-20. So once you inform your school that you have a son, you have a daughter, you want to bring to you in the United States, they will issue another I-20 for that dependent. And that I-20 is joined to your I-20. So you find them on your I-20, like in the second or third page, you find those spouse and your children. So now it's a combined. So wherever they enter your service ID, they have your spouse and your child details attached to it. So even with your visa that your spouse or your child will go for, that visa is tied to your visa.
Okay.
So once there's a divorce or once there's something, then it means they are out of status. That's how it works.
Okay. So if you are applying, let's say you had your your funding and everything, can you apply for their visa at the same time and relocate with them at the same time? Or you need to go and then later you apply?
You can go at the same time, and that is the best thing to do. It's just that sometimes you might think that, there are situations there, I need to go and test the waters first. But hey, the best thing is just go to the interview together and you all be granted a visa.
Okay. Does it matter? Does it make it easier or more difficult if, let's say, you marry in the course of your program? you were not married before you had that offer, but you married in the course of your program. Does it make it a bit difficult to migrate or to move your spouse?
No, it's actually not a difficult process. Now, the whole thing making things complicated is the appointment date at the embassy. That is making things complicated. But it doesn't matter if you want your family to join you at a later point. Of course, if they find early appointment, that's cool. But now there are no appointments. So, for instance, there's a candidate who just got admission who is trying to come to the US. You are married, you have a child. You can go together and get a visa for them. You can let them even stay behind. Once they have the visa, they can enter as long as you are here. So they can stay and you can, but trying to work on yourself alone and later trying to go through them, let them go through another process, sometimes it's a bit difficult, especially in regards to looking for appointments.
Okay. I mean, we are just out of time. So on this visa, moving family, is there anything I have missed out that you want to mention just on the visa application for family?
Well, I would say that you can move them in, but you need to have that source of income to take care of them because your stipend cannot survive the 2 of you or 3 or 4 of you. So you need to have other source. That's why they requested that you show proof of funds to manage them, because here it's not like you are in Ghana that you can, let's say, rent a single room with your family. No, it doesn't work that way. The laws doesn't permit that. So you need to make provisions and know that yes, I should be able to take care of them, both the wife, the spouse, and everything. Yes.
Can your wife work when she moves in with you, or your husband, if it's the other way around? And if yes, how many hours per week, for example?
So now the visa, we have 2 forms of visa. We have the F and the J visa. The F, which mostly that's what students come on. Your wife cannot work. Your child cannot attend a higher learning institution. They can go to crèche or kindergarten or elementary school, but they cannot go any higher education. Your wife can also go to school. They cannot engage in any monetary issue. They can only do voluntary work. So the F2, which is normally what the students come with, what we usually come with, your wife cannot work. But we have other visa type, which is the J1. The J1 is more like an exchange program between maybe Ghana and the US. So let's say you are being sponsored by Get Fund, you are being sponsored by GMPC, then it means probably you'll be coming on J1 visa. For the J1, your wife can work full-time, 40 hours a week. That one, if you are coming on J visa, it means your wife can work 40 hours a week. But there are other issues associated with this F1 and J1, because for J1, right after your completion of program, you need to return back to your home country because your home country sponsored you. You've gotten the education, you've gotten the knowledge, you need to go back to serve them. But the F1, you can go back to your home country. At the same time, you can also look for a job here in the US.
Okay. My last final question, I'll be very quickly. I know people in other fields have moved straight from bachelor's to a PhD, for which reason they are either doing a combined PhD, a master's, or whatever. Ivans, yes.
Yeah.
Great. So do we have such programs for nursing? Can someone with a bachelor's in Ghana, Nigeria, wherever, move straight away into a PhD program in the US?
Yes, of course. Here, you see, this is about as at the beginning of our interview, I said that we need to organize these career seminars for them. You see, here in the US, right after your bachelor's, there are 2 things involved. It's either you are moving into industry, let's say the bedside, or you are moving into academia. If you want to move into academia, then from the BS, you can move straight to PhD. So there's bachelor's to PhD, just that you're going to spend like 5 years or 4 years in your program. And of course, if you have a master too, you can use it. Just for my situation, for my program, for instance, it's just 3-year program because I already have a master. Then if you want to move into the bedside, then right from your bachelor's too, then you move to your doctor of nursing practice, the DNP program. So you don't need a master to move into most of the program, but there are some specific universities that they require that you have a master before you can apply. Of course, there are other universities that right from your bachelor's, once they assess your transcript to get to know that you've taken some courses, that is where Ghanaians we lag behind.
Okay.
For instance, the statistics courses, sometimes they require that you take graduate level statistics. So how do you take graduate level statistics in your undergraduate program? So it becomes a barrier. And sometimes they require that you take health policy course, especially when you want to divert from nursing into policy and planning. They require that you take a health policy course, at least in your undergraduate program, but we don't have it in our curriculum. So, but there are, of course, other universities that they'll give you that room that you can apply from your bachelor's to PhD. There are a lot of them. Most of them do accept it. You just have to make a strong application.
Chief, it's always a pleasure speaking to you. Sure. We are not out of words, of course, but we are just out of time. What are your final words, to us in a minute or two?
Well, I would say that the biggest investment that you can make is to invest in yourself. And as young as you are, you need to sacrifice and make hay while the sun shines, because you need to prepare yourself for the future. Most of us, we are in early professional life, and we need to sacrifice now, do multitask a lot of things, just so that at least in the next 5-10 years, we will sit back and at least enjoy what we've toiled for. So just invest in yourself. And the best competitor is yourself. Always try to be the best of yourself, whichever day comes. Yeah.
Brilliant. It's always a pleasure speaking to you. Some comments, Irene Bosman says, wow, incoming Minister of Health. Irene again also says that, wow, such eloquence and analysis of Ghana health system and nursing curriculum. You are an inspiration, senior, go high. Samuel Achim says, watching you live, give it to us, boss. David Amayao says, Charlie, the guy is a research ampa, 5 schools a day. Ernest Obain says, wonderful input into the application process. Mame Amasika says, I see you, Sir Evans. Achim again says, maybe we should start demanding conditions or conditions of living allowance. I think so. Aaron Bosman again says, it's very true, especially in the management of sickle cell among blacks in the US. During their crisis, it's been reported most times that clinicians ignore or downplay their pain. And Emmanuel Ekbo says, pediatric is a layman's term. And David Amiyao finally says, great interview and insights. Thanks, Evans and Precious. Thank you very much, viewers. So this is the Discovery Show here on YouTube, Instagram, Twitter, and on Facebook. Basically, what we do is that we bring guests here, we interview them, explore their lives, draw inspirations. It's not a time for us to, in quote, people to sell themselves or boast of their achievement. The main purpose is for them to tell us their life trajectory, for us to draw inspirations from that, and so see it in that particular light. And also encourage yourself. Please subscribe to our channel if you have not done so. Encourage family, friends, and colleagues to subscribe and follow us. There are a lot to be learned on this platform, and we hope to bring you the best of people as well, as we have tried to do. Frank Amoboache says, please, you need this man to do more interviews. So Evans, definitely, we'll bring you some more. We'll bring you here some other time for us to talk about other things. So thank you very much, viewers. Evans, it's been a pleasure having you. We are grateful that you were able to come, and have a very lovely time, and stay blessed. Thank you, viewers. Thank you, Evans.
Yeah. Thank you.
Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining, because I'm a real good, I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you, at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before they blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air. Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James.